Hi, it's been 3 years ago today since I've had my thyroplasty, and I'm doing great. My voice is good. That's one of the reasons I wanted to do an update. I'm sorry it took me so long. I've had several people ask me about it, and I'm a procrastinator. So, anyway, finally I'm doing it. And I just wanted to say hi to everybody, let you know what my voice sounds like 3 years after. It's great. I don't have any problem with it. The only thing that sometimes I have is some choking still. Um, that's usually if I don't know, if I'm distracted or something, like I'm talking to somebody while I'm eating. I tend to choke a lot more easily. But that has been more recent. I'd say the last 6 months to a year that I've kind of had that a little bit, but it's nothing compared to when my vocal cord was, before the thyroplasty. Um, anyway, I wanted to let you know my voice has been great ever since. I don't have any problems. I can sing. If I sing too much, then I think it works the good vocal cord too hard, and then it's a little bit of a problem. But I mean, as far as just, I can just feel like that vocal cord's getting tired, so then I just kind of stop. But for the most part, but it's great to be able to sing. I know I've seen a lot of people say how much it bothered them not to be able to sing, and that was hard for me too. Um, So, but I have had a new issue since all this started, and that is I've had a neck surgery. Um, it is a C2 to T2 fusion. So it's a second cervical spine to the second thoracic spine fused. And that was because I had severe cervical stenosis with radiculopathy, and spinal cord compression. And the way I found out about that was I was having pins and needles in my hands and feet, and then it gradually went up to my forearms and my lower legs. Then I started having nerve pain in my forearms, like a carpal tunnel type of thing. And then I started waking up, and one of my arms would be basically paralyzed. And I just thought, well, I've slept on it wrong, or, I mean, I should have gone in a lot sooner than I did. But anyway, so I went in and I saw, they sent me to a neurologist. The other thing was I drove and I would drive for like 10 minutes and my hands would go numb. So I knew something neurological was going on. And when I saw the neurologist, they thought I had MS, and I had an MRI of my brain and my neck. And it turned out that it was actually compression of my spinal cord and really severe arthritis causing a lot of issues with the bones in my neck. And anyway, I was having spinal cord compression. My neurosurgeon said that when doesn't normally see an MRI of like mine unless the person was paralyzed, and basically I was becoming paralyzed. So some people have a lot of pain, like the nerve pain with it, but I really didn't. So anyway, it was really hard to undergo a surgery like that, knowing that I was going to be in a lot of pain afterwards. A posterior fusion is very painful. So anyway, the reason I mention that is because I do think it may have been the reason that my vocal cord was paralyzed. So they called it idiopathic vocal cord paralysis, which means basically they don't know the cause. But I had, prior to the thyroplasty, prior to the vocal cord paralysis, for a year, I would have episodes of what they call laryngospasm, but I called them throat closing episodes. I mean, it's just like 1 minute you're sitting there and the next second your throat is closing. Um, and I had those episodes for a year before my vocal cord became paralyzed. And anyway, those are awful. But then my vocal cord became paralyzed, and I knew something bad had happened. And so anyway, I had the thyroplasty, but even after the thyroplasty, I had episodes of the laryngospasms. So, but after my neck surgery, after the cervical fusion, immediately my throat felt differently, like that was gone. I didn't have that problem anymore. And so basically, I'm saying that because I think what happened was the compression on my, the nerves, the spinal cord and the nerves of my neck also caused problems with the recurrent laryngeal nerve and the nerve to the nerves to the vocal cord. I'm just sure it had something to do with that. And then it wasn't really unknown that it just took a while to show itself. And I think that it was the spinal cord compression and the nerves being affected in my neck and my throat. So I just want to bring that up because anybody that has an idiopathic vocal cord paralysis that or they say they don't know why your vocal cord is paralyzed, if it were me now, I would request an MRI of my neck to say, look, I know somebody that ended up being their spinal cord was compressed, because now I don't have those problems anymore. So, in my voice and my throat never did feel right until after my neck surgery. Although after the thyroplasty, it was much better. Like I could talk, I could breathe, I could not choke so much. That surgery changed my life, absolutely. And this surgery did too, because the neck surgery, because I'm not paralyzed. But I do have a lot of pain from it. So I'm still trying to get that figured out. And I'm not able to do, things I could do before. It's just a new normal for me. But I'd rather be like this than to be paralyzed. And my disease of my spine is progressive, so that may happen eventually. But right now I'm good. And my neck surgery was 14 months ago. So yeah, it's been a rough few years with all of that. But I think I'm on the other side of it. So doing good now. So anyway, I just wanted to update you guys. I know a lot of people have requested that, and I've really wanted to do it. I just, I don't know what my problem was. But anyway, since this is a 3-year anniversary of my surgery, I thought it was a perfect time to do the update. And I just want to wish you guys the best, and don't give up. Also, there's a Facebook group that I'm a part of that's really helpful, I think. For people with vocal cord paralysis. I think it is called Vocal Cord Paralysis Group or something like that. And it helps you go there and not feel so alone. Like I wish I had or known about it when I was struggling the most. But now I go mainly to help other people if they want to know what a thyroplasty, if it works, or if the injections, work, things like that, then I'll comment on that. But anyway, I wish you guys the best. Don't give up. I think I'm proof that there's hope. And that's a good thing to know when you're in the situation that a lot of you are. So just hang in there. Don't give up. you never know what's around the corner for you. So anyway, and comment. I've enjoyed talking to other people that have had similar things and have questions. So anyway, I wish you all the best. I hope you have a great summer. And I will post again soon if anybody wants me to do that. You guys take care. Thanks.